नमस्ते बिटिया हमेशा खुश रहो A very good morning to you all. Myself, Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine, and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH, University of Jain. In this series of disease of elementary practice orders, we are going to start with celiac disease today. In the journey till now, we have discussed about various introductory lectures about various topics, common symptoms we have discussed, like dyspepsia, dysphagia, vomiting, JV'n, and the pain abdomen. Peptic ulcers we have discussed. We have discussed about cellular syndrome, and also dyspepsia. We have also discussed about gastric carcinoma. And in this series of lectures, we are going to discuss about celiac disease today. So this is a very important disease because being a homeopath, we will get a lot of patients with celiac diseases. And the celiac disease, the modern medicine has no effective treatment. Homeopathy offers a very good treatment for such cases. So let us first understand what celiac disease is. So celiac disease is basically an immunologically mediated inflammatory disorder. So it is immunologically mediated inflammatory disorder of the small intestine, resulting from the intolerance to wheat, gluten, and similar to that. So it is immunologically mediated, means immune mediated disorder is there, and this is resulting from the intolerance to wheat, gluten, and similar to that. So the person is not able to take wheat in any form, the wheat, gluten. The celiac disease is common cause of malabsorption of one or more nutrients. So it is common cause of malabsorption of one or more nutrients. The etiology of celiac disease, the exact etiology is not known, but there are environmental, immunogenic, and genetic factors that play an important role in the etiology of celiac disease. So, three factors: environmental factor, immunological factors, and genetic. So, these play a very important. The hallmark of celiac disease is abnormally small intestinal biopsy. So, intestinal biopsy is done to assess or to diagnose the case of celiac disease. The celiac disease is identified by small intestinal biopsy or by serological studies. Example: anti-endomysial antibodies, tissue transglutaminase (TPG), deaminated gliadin peptide. Now, how the case will present to you with the celiac disease. So, celiac disease is considered as an iceberg disease. Iceberg disease means very less is known about celiac disease. We know only about a few symptoms of celiac disease, while a big picture is hidden inside the ocean that we cannot see. And there are only a small number of individuals who are coming to us. The diagnosed cases are only a small number, and undiagnosed, there are a lot of undiagnosed cases that are present in the society. So, a small number of individuals have classical symptoms and manifestations to nutrient malabsorption. The onset of symptoms can occur at all the points from the first year of life throughout the 8th decade. The larger number of individuals have atypical celiac disease. So, atypical celiac disease is manifested by the manifestations that are not obviously related to the intestinal malabsorption. So, most of the cases, a large number of cases that are coming to you, these are having atypical celiac disease, and the manifestations are not obviously related to intestinal malabsorptions. Finally, an even larger number of patients have silent celiac disease. So, they have silent celiac disease without any symptoms. The clinical features of the celiac disease. The symptoms of the celiac disease may appear with the introduction of celiac into the infant's diet. So, as and when the cereal are included in the diet of the infant, then the symptoms start appearing. They then first become evident at the most any age throughout the adulthood. So, initially, the symptoms arise as soon as the infant start eating the cereals, and the symptoms may arise at any time, any particular time, and throughout the adulthood. The symptoms range from significant malabsorption of multiple nutrients with diarrhea. So there is malabsorption of the multiple nutrients with there is diarrhea, there is steatorrhea, that is fatty stool, there is weight loss, and consequence of nutrient depletion. So there are different nutrient depletions that I've seen. That is anemia and metabolic bone diseases. With the absence of gastrointestinal symptoms, despite evidence of the depletion of single nutrient, example iron, folate deficiency, osteomalacia, edema, and protein loss. So there is loss of weight, there is loss of absorption of essential nutrients. So there is nutrient depletion, absence to the gastrointestinal symptom, despite of evident depletion of single nutrient. It typically presents with diarrhea, malabsorption, and urology. So the patient mother comes to you with the patient and says that the boy or the girl is not gaining weight. The patient is eating good, but the patient is not gaining weight, and he or she cannot tolerate wheat in any form. The older children may present as a non-specific feature such as delayed growth. So there can be the sign and symptom that the growth has stopped. The child grew to a particular age, to a particular height, and then the growth suddenly stopped of the patient. The features of malnutrition are often found on examination, and mild abdominal distension may be present. So there can be mild abdominal distension. The affected children have both growth and pubertal delay, leading to the short stature in adulthood. So the affected children have both the growth delay and the delay in the development of secondary sexual characters during puberty, leading to short stature during the adulthood. There are non-specific symptoms which can be present like tiredness, there can be weight loss, folate deficiency, or iron deficiency due to the malabsorption of particular single like iron or folic acid or any particular element. Other recognized presentation includes oral ulcerations, dyspepsia, and bloating. So the other features which can be presented, feature of this particular disease, celiac disease, can be dyspepsia, bloating, and ulcerations. Now, what are the different investigations that could be done in the case of celiac disease? We can go for the urinary biopsy. The urinary biopsy, endoscopic small bowel biopsy is the gold standard. So we have to do endoscopic small bowel biopsy for the villus atrophy is usually characteristic. The antibodies consist of IgA, anti-endomysial antibodies, the TTG, tissue transglutaminase acid, the hematology and biochemistry. The microcytic and macrocytic anemia from iron and folate deficiency and features of hyposplenism. There is reduced concentration of calcium, magnesium, total protein, albumin, and vitamin D. The other investigation consists of the measurement of bone density. Now, how will you manage the case of celiac disease? The management, although I have stated that there is no specific treatment in the modern medicine for the treatment of celiac disease, but homeopathy offers a very good result in such cases. So, correct existing deficiencies in the modern medicine, we have to correct the deficiencies. The malabsorptions have to be corrected by the supplements of iron, folate, calcium, vitamin D, and commence the lifelong gluten-free diet. Exclusion of wheat, rye, barley, and initially oats. Supplementation by minerals, various minerals and vitamins. Treatment with corticosteroids and immunosuppressive drugs, because this is an autoimmune disorder, so corticosteroids and immunosuppressive drugs are given. Rice, maize, and potatoes are satisfactory sources of carbohydrates. So these can be given in terms of what are the different complications that we see in the case of celiac disease. There is increased risk of malignancy. So it can lead to malignancy, particularly of the enteropathy-associated T-cell lymphoma. Small bowel carcinoma can be seen, and squamous carcinoma of the esophagus can be seen in patients of celiac disease. A few patients develop ulcerative jejunal uveitis, fever pain, obstruction, or perforation with them. Due to the decreased absorption of vitamin D, there can be osteoporosis and osteomalacia may occur in the patient with long-standing diseases. There is another condition called dermatitis herpetiformis that occurs along with this celiac disease. So, in less than 10% of the celiac patients have evidence of dermatitis herpetiformis. It is characterized by crops of intensely itchy blisters over the elbows, knees, back, and buttocks. All the patients have partial villus atrophy or the JV'n biopsy with no gastrointestinal symptoms. The rash usually responds to gluten-free diet, but some require additional treatment with capsule. So that dermatitis hepatic illness is also associated with celiac disease. So this is the picture of dermatitis hepatic illness. So this was all about celiac disease. In the next lecture, we will be discussing about adverse food reaction. So this session was covered by digital version 2.0 JAYOTI VIDYAPEETH Women's University. I hope you are satisfied with the digital session. If you have any query, please mention in the comment box and I will try to resolve it. So this was all for today. We will meet in the next lecture. Thank you very much.